All right. Welcome to the Sunday night Glenn Kelly for Governor We the People live stream. I'm here with Glenn Kelly. Glenn, welcome.
Thank you for having me. It's awesome. How you
Yeah, so
doing?
I'm doing fantastic. Before we get started, I just want to say something, man. You know, I support you for governor, not because you're a polished politician, right? I support you for governor because you're a real person. And you know what? Here's something that, we've had a lot of conversations over the past couple weeks, past couple months, right?
Yeah.
And one thing that I know, like if I tried to get you to do something that you disagreed with, like morally and ethically disagreed with, you would tell me to fuck off.
Absolutely.
Yeah, and
I do have a
that's
nice way to
why.
start out with, unless you pushed it.
Well, that's why I trust you. It's like I don't think that you're going to be able to be bullied by lobbyists. I just don't think so.
No, yeah, that's. I don't even think there should be lobbyists. So
Yeah,
that's
I
just, yeah.
I agree with you.
To
And
me, they
another
don't
thing,
exist. They're not real.
well, another thing too is that you've agreed to be live streamed
Yeah,
while you are doing your job.
absolutely. All politicians should wear a body cam when they're in the business of doing business for the people,
Yeah, I agree.
and not
Yep.
in their private life. They do whatever they want in their private life. I don't care. But when they're in their political position, in
Yep.
their position of authority or whatever it is, they should all be wearing body cams with microphones. Everything recorded. Every
Yep.
one
If
of them.
they're in the Capitol building, have you been to the Capitol building in Olympia recently?
Not recently. I have not. Nice building.
So, even not recently, but every state legislator, the state reps, and the state senators, they all have their little rooms, right? And there's
Right.
benches outside, and the lobbyists just sit and wait for their turn to go in that little room to have a private conversation about the people's business.
The people should be able to know what business they're talking. If it's the people's business, they don't have anything to hide because it's
Yeah.
the people's business, not their business. And they're there to represent the people.
Yeah, imagine if there was a website or a YouTube channel you can go to, and you go to Washington State, right? You click on Washington State, and then you can pick your senator or state representative, and you click on it, and you can hear and see the conversation that's going on in their office.
It's a hot mic.
Hot mic all the time,
Yes.
all the time.
Yeah. They do the when they're in session and all this, they record that and let you watch that. But you don't get to see what they're doing in their office. And you need to know what they're doing in the office. You need to know that. It is our right to know that because they represent us. And if I was any type of elected official in any way, shape, or form, everybody needs to know what I'm doing, what I'm saying with these private people that are not politicians,
Correct.
so that they know
Well,
that I'm not taking money to satisfy these people.
I'm gonna I'm going to guess that the conversations they're having are something like this. Governor Kelly, I would like, on behalf of our organization, to donate $100,000 to you. However, we really need you to push this bill forward. That's probably how it's going.
Wow, I'm a lost word. That's bribery and coercion to the it ain't right. That is not right. It should not happen. It should not be allowed.
So at least if we have live streams during office, right, during session time when politicians are in their offices, at least they have to do it outside of it. But the reason why I bring this up is because this is what has happened with pharmaceutical companies and the government.
Right.
Right. They've had these private meetings that push pharmaceuticals and allopathic medicine onto the American people and have made natural medicine substandard is a nice way to say it, almost outlawed.
That's what I was just going to say. Pretty much outlawed because You're not allowed to use it with your insurances. Even people Medicaid, Medicare, all that have no choices. You
Yep.
have to go to the doctor they tell you can go to, and that is not right.
Yep.
Private insurance and public, they're both the same. You do not have a choice. You have a choice of what you do. Okay, I'm sorry. Let me explain that. You already know this, I know. But for those who don't, you have a choice to choose the choices that they give you, not the choice that you would like to use. So if I wanted to go to a naturopath rather than a regular doctor on insurance, I'm not allowed.
Nope.
I got to pay for that out of my own pocket.
Yeah.
And
so
it's not right.
Let's talk about this a little more, right? Health freedom. What does health freedom actually mean?
It means different things for different groups, depending on who you're participating with.
different things for different people?
It is different because, I mean, the way it is set up right now, if you're on assistance with the state or whatever, right?
Yeah.
You can only go to certain doctors. And you have to do what these people tell you. They will only allow certain things like insulin. They will only let you get certain types of insulin, not what the doctor prescribed you.
Yeah.
They switch it when you go to the pharmacy. Oh, well, you're only allowed to get this kind. But it's a substandard. What if it is a substandard? Do you know if it's a substandard? There's no informed consent on that.
Yeah. So then health freedom in that situation would mean, how come we can't buy our insulin from Canada or buy our insulin from Mexico or buy our insulin from Poland? Like,
right. You know, I have a perfect situation. My wife had procedures for weight loss, right? Bariatric surgery. Here, with insurance, if you had insurance, you're going to pay like $10,000 to $20,000 out of your pocket with your insurance. Down there, it's about $6,400. That includes your flight, your hotel, your surgery, and everything. And their doctors are way better. People are, what do you mean they're better down there? Well, the doctors here, they might perform 25 to 50 bariatric surgeries a year. Down there, they're doing 50 to 75 a day. Who do you think is going to be better at it?
Well, the person doing more.
And it's a hell of a lot less money.
Yeah. Do you want the carpenter that works every day, or the one that is a hobby carpenter that built a cabin in the wood once?
Exactly. That's exactly perfect. And that's the way it is. Here, to get your teeth fixed, it's about 80 to 100 grand, or 65 to 100 grand to get the implants. I think down there it's like $10,000 to $15,000.
Yeah. That's way cheaper. Yeah, I saw that too. Yeah.
It's
because of freedom.
There's no freedom here because it's all about what you're talking about is those lobbyists. And that's why the price is so damn high. And it's not right. It's everywhere.
Yep. Absolutely. All right. So let's take a look at some other aspects of health freedom, right? Yes. So bodily autonomy. Every person owns their own body and the medical decisions.
Do they?
Right. So when COVID happened, well, that in health freedom, if it's free, right? When COVID happened, though, that wasn't the case.
No, it changed like that.
Yeah, if you worked for the government or you wanted to go to a small business or you owned a small business, right? That's not health freedom. If you want to go to Walmart all day long, 24 hours a day, go to Walmart. Just make sure and follow the arrows on the floor.
Wear your mask. Wear your mask.
Wear your mask. Yeah.
A mask that doesn't work.
Yeah.
And the reason I bring up mask, just a real quick interject on that, I'm literally certified. I went to school for it, for what the different masks and respirators do. Those masks do nothing to stop a virus, period. And that's been proven now.
Yeah.
But they're going to make us wear it again if there's an outbreak of anything. And people are going to comply.
I don't think so. I think there's going to be a lot more pushback.
I hope so.
I think there's going to be a lot more pushback. You know, those masks, they literally build bacteria in your face. And they cause you to get sick.
Yes, it's
if you're not. You need to breathe fresh air, just like you need sunlight, just like you need water. Like,
you know what? I just got to bring this in there because it's a true fact that people don't realize. You know, for people to lose weight, do you know that it is a fact that to lose weight, 80%, you wonder where does that go when you lose weight? Where's it leaving your body? Your pee, your poop, where's it going? 80% of the fat that you get out of your body to lose weight comes out of your breath. Did you know that?
interesting. Yeah, because of
If you're breathing.
water weight.
Yeah,
Yeah.
if you're breathing, when you breathe, you're expelling more than just the bad stuff that you just, process. Fat and all that comes out with your breath. And I know it sounds weird, but it's true.
So I've weighed myself when I went to bed, and then you weigh yourself when you get up in the morning, and you weigh less. And that's because you're expelling this water weight and everything else in the process.
Exactly.
Right? So with COVID and everything that happened there, there really wasn't any informed consent.
Zero
informed consent. Like they said they had no idea what the side effects were going to be of the vaccine. They just made everyone get it, right? And that's part of health freedom, is to know and have consent on what it is that you're injecting into yourself or eating, right?
Right.
Yeah, you brought up a good point earlier about the informed consent on processed foods in the grocery store.
There should be warnings. It's just my belief. This is me.
Yeah.
But I believe if it's poison and it can be proven that it's poison, they should not allowed to be able to sell it to the public, informed consent or not. If it's proven that it's bad for you, they shouldn't be able to sell it to anybody, because not everybody is educated or even has the capacity to understand.
So I'm a voluntarist, right? I believe in voluntary interactions. And if you want to buy a pack of Oreos, you should be able to, right? But at least have the Oreos say on there, like, hey, this could cause cancer. This is going to clog your arteries. This is going to do these things. But yeah, you can buy that shit.
Yes,
just like cigarettes have a warning on them, just like alcohol has a warning on them, right? But for some reason, these food companies, well, I know the reason, because they've paid the politicians, but they are not required to have warnings. Does that make sense?
Right, and it makes no sense at all why they don't.
Yeah,
it makes no sense. It's like the old snake oil said, he'll come into town with his wagon. This will cure this. This will cure that. But then when they find out what he's giving out does nothing and it's bullshit, they tar and feather that guy and send him the fuck out of town.
Whoa, tar and feather, man! If they
brought back tarring and feathering, what do you think would happen
to the politicians, to the oligarchs? Yeah,
the pharmaceutical companies.
Yeah, that gets back to the live streaming. We need more live streaming. Yeah, so health freedom goes back to voluntary choice, right? Not coercion, not mandates or threats like we've seen in the past.
Right.
Because if you're on public health care, right, quote unquote universal health care, you have to do what they tell you to.
Exactly.
That's not universal, right?
That's not freedom at all. If you want to keep your insurance, well, it's like the military. We talked about this before. If you go in and take a P test, you're in the military, you're retired, and the THC shows up, guess what happens? You're not getting your retirement anymore.
No way. They cut off their retirement?
Don't they cut off their retirement?
That's why my dad won't do anything for his
Right.
team.
Yes, they will cut your retirement off.
Yeah. And yet, well, I know they cut their health care off.
I think they cut the retirement off also. Don't
wow.
Me, but that is my belief.
Yep. We're not going to look it up right now.
I'm pretty positive, though.
I can confirm it, but
we can look up some confirmation on that, right?
Yeah, no worries. All good. All good. So
yeah, medical freedom for the military is fucked up. They have less medical freedom than anybody.
Yeah.
for real. When they go in the military, but they signed up for it. You literally sign your life over. And that's why they give them all those different vaccines.
Yeah.
And they have to get them. They can't refuse a vaccine or they won't allow to be there, right?
Yeah. They're property of the government.
Right.
Once you sign your life away for 4 years, 5 years, and like you are giving yourself to the government.
And that's your fault. If you did it, that's on you. You know
But
what I mean?
the thing is, it is a noble idea, right?
Absolutely.
To protect the United States, protect your neighbors, protect everyone else. It just seems like our government is kind of overextending itself in the Middle East and now in Venezuela and all over the place. We're like giving money to like 177 different countries around the world. It's
Right.
insane.
Well, yeah,
Well, we can get into that.
Kind of brainwashed. It's like you had mentioned another time about the Romans and Caesar. Do you remember what you said?
Yeah. So if you give your children to Caesar, don't be surprised if they come back as Romans.
Exactly. And that's what our education system does. And it's also the military does. It's the same thing.
Yep. Yeah.
Absolutely.
Education for sure. Okay, so let's talk about that, right? So guess who shows up at high school campuses? Military recruiters. And they got their pull-up bar, right? They got the pull-up bar and they're doing their thing and they're talking to all the kids. And if you send your kids to government education, they're being programmed to believe whatever it is that they're being told. And now in this situation, there's, talk about changing genders in government education, right? And is that really freedom or is that programming?
Well, it's not a federal thing, but state by state, the laws are a little bit different, right?
Mm-hmm.
But Washington, it seems to be red states. Washington is the worst of all of them that I can find so far as I look up the different laws on that.
Mm-hmm.
So after the age of 12, you don't, as a parent, have the right to be even in the examination room with your child, let alone get the information. If the child says, I don't want them to know anything, they ain't got to tell you nothing. Mental health, all of that in Washington, 12 and older, they don't have to notify the parents. But you know what's really crazy? And it's true, it's crazy. You can look this, anybody can look it up. In Washington State, gender affirming care, as far as medical changes to the body, you know what the consenting age is for that?
What?
There isn't one. If your child is 5 years old and wants to have gender affirming care, they tell their counselor or whatever at school, they'll get gender affirming care, and the parents are not notified. Did you know that? They don't have to notify the parents.
I did not. No.
The children have the choice. Parents don't have a choice when it comes to that. That sounds to me like it's a bunch of pedophiles.
Yeah, so right back to that quote. If you send your kid to Caesar to get educated, don't be surprised if they come back as Romans.
That's right.
Right? If you give your kids up,
oh my God. It's hard for me to talk about it.
If you give your kids up to the government education system, that might be a possibility.
Right, because they have such an influence too.
Yep.
In school. I mean, they see your children more than you see your children.
Yep. Oh yeah. And
they're working while they're in school for that 8 hours. We get home. Hell, we're trying to get in bed in the next 2, 3, 4 hours.
Yeah.
And doing our chores, catch up, we don't even get to spend time with them.
And the thing is, when the kids go to school, they are sitting in a desk. They have to look straight forward. If they don't, they get in trouble, right? They have to focus in on whatever the teacher is saying, no matter what, whether they agree or not. They're getting programmed. It's psychological programming, and this is just basic, Freudian psychological programming.
It is.
Repetition is the second law of learning. Repetition. Yeah, repetition is the second law of learning. So if your kid is sitting there in a classroom being told that they could be a boy or they could be a girl, and they get to decide, and over and over and over again, every single day, your kid is going to start absorbing that into their subconscious minds.
And then they'll be talking back at home, hey, I'm the boss here. They told me it's my decision.
Yeah, it's their
and then
decision.
it makes the kids rebel against their parents and cling to the state.
Yep.
It's like, it's almost like they're programmed that way.
Yep, absolutely.
Right?
That's why we need freedom, we need choice and education. If you want your kid to be programmed like the school board in your local area wants them to be programmed, then you can send them there. If you want your kid to be programmed in some other type of education, Cambridge, or just learning the basics, or going to a trade school, or doing whatever the kid wants to do with their life, we should have the options, right? Because now we're just forced to do one thing or pay for everything ourselves. Here in Washington State, like, we homeschool, okay? And I just paid $13,000 in property taxes, but we don't send our kids to school, okay? So where is the money that we need to provide education? We have to do it ourselves. We now have to put that money up ourselves to provide our own education.
Right.
Yep. Or we could send our kids to the government education, which, last year there was 2 suicides at the high school. You know what I mean? Kids are getting bullied all the time, and we hear about it. We do not want to send our kids to that.
No, it's absolutely horrible. It's they're being indoctrinated into obeying, not just that, but authority. And they see medical as authority also. Oh, that's a doctor. Oh my God, that's a doctor. We have to listen to them. Yeah. They know everything. Doctors don't even take 2 weeks of nutrition in college.
Yeah.
If they're lucky. They know nothing about nutrition. All they know is what they're told to do.
Yeah. So food pyramid.
Everybody is indoctrinated on one level or another.
Sure.
And they obey, or they don't eat. They don't have a home. Yep. They don't have anything. I
like the idea of questioning everything. You know what I mean?
And transparency.
Yep.
We need to be able to see everything. We need to know. Well, lobbyists shouldn't even be allowed. The only lobbyist that should be allowed is the citizens' opinion. Going in there to say, hey, this group over here from this county, this is what they want. This county wants this. How can we all come to an agreement on a state level for all the counties? By listening to everybody. Everybody should have, but it should, like I say, it should go down to the county first. We talked about that. County sheriff should be in charge of, he's like the president of the county, right? And there needs to be a collective of all the sheriffs coming together within a state. But that doesn't happen anymore. It used to, but it doesn't. And I'm sure that, like pharmaceuticals, all the health freedom, I'm sure most sheriffs would agree that you have the choice what to put in your body and what goes in your children's body and what happens to your children. Because for God's sake, you're in their county. It's your community and theirs together. You vote this person in to take care of your people in your county, right? So it should really start at the county level, then go to the state level, and then the federal level.
Yeah.
Federal level should never supersede the state level, and so on. They're there just to make sure that there's no tyranny going on with the governors, right? And then the governor's there to make sure there's no tyranny going on with the sheriffs as their overseers is what they're supposed to be. That's all. Sorry. I just had to interject that. People don't understand how it's supposed to work.
Yeah. And the system is set up it should be set up actually to protect the rights of the individuals. And
Absolutely.
there's a weird level of checks and balances because right now, here in Washington State, Bob Ferguson thinks that if the state makes a rule that says everyone that works for the government, no matter what their county says, needs to get injected with an experimental vaccine, that they have to, or they lose their job.
Right.
Right. He believes that he can supersede the counties.
Right. And that's not true. That's not the way it's supposed to work. You got a county, citizens within the county. This is what they want, the majority want. The sheriff is supposed to enforce that, what they want. You got another county over here wants the opposite. Well, you can do that, but you're not going to tell this county over here that they got to do what you're doing.
Yeah. So our sheriff here in Pacific County, and he talks about this a lot, he is not subject to county ordinances. He is subject to the Constitution of the United States.
Yes.
Yeah. He's not subject to these random rules that the county commissioners make. Sorry.
That's right. They're supposed to enforce the Constitution.
Yeah, because these county commissioners make all kinds of crazy rules. They add all kinds of ordinances that infringe on our natural rights, our property rights.
Exactly. And it's the sheriff it's supposed to go to the sheriff. He's supposed to approve or disapprove that.
Yep.
But he's supposed to go to his citizens in his county and ask them, do you approve this or disapprove this? Right? And
yep.
What's really, he's there to represent the people. The people. He's supposed to represent the people in his county. Period.
Sure. Well, not every sheriff is like that, though.
They
should be. They're supposed to be. Yep.
That's the way it was designed. But these people that are greedy for power have slowly eaten away at the power of the sheriff.
Yeah.
For their own gain.
I'm going to try to get go ahead. I'm going to try to get my sheriff on our show and see, because he's good.
There too, because he's a controversial sheriff here in Pierce County, also to these other people that don't want to follow the Constitution.
Yeah, yeah.
And push back all the time.
Yeah, he pushes back all the time. They're trying to get him, but he's a constitutional sheriff, and I hope he comes out on top. And that's Sheriff Swank. And he, hopefully he's beaten the system that's trying to tear him down.
Yeah.
I haven't been updated on that lately, but we shall see.
So let's hop back over to health freedom.
Yes.
Because we've gotten a little off track.
Yeah.
So the CDC and the FDA, their boards are filled with former pharmaceutical executives, right?
Yeah.
So should we really be paying attention to what they're advising?
No. Why are we doing? They can advise whatever they want, but people should be able to make their own choice if they're given the information. But they're just giving the CDC and the FDA giving their opinion.
Yeah.
They're not giving you the information on how they made their opinion. We should be given the information so that we can make our own opinion.
Yeah.
And then recommend it for ourselves or not. That would be freedom.
Yeah, but I don't really trust them to give us all the information. Like, look at the situation with COVID.
It's like the pharmaceutical companies. They haven't ever cured any disease that I know of in over 100 years.
They just keep.
If they were to cure the
pushing
disease,
the pills,
they'd be out of business.
Yeah.
And it's a $1 trillion business a year, I'm sure.
Yeah.
I mean, I don't get the greed. I don't understand. I'm millionaires back in the day, you thought, oh my God, I'd like to be a millionaire someday. But then you got billionaires. It's like, if you understood what $1 billion really is, It's like, wow, you could never spend that money in your lifetime.
Yeah.
It's insane, the greed. The greed is, and that's what, right, when people get up to a certain level in the politics, even, oh, you mean these? I can get money from these lobby. These guys are offering me money. Oh my God, I could be a millionaire in like 2 years, and that's what happens to a lot of them, isn't it?
Yeah, it is. Yeah,
And they just
and
they
the
get
pharmaceutical
overwhelmed.
the pharmaceutical companies are using cronyism to make laws and rules that people have to use them and have to use their products, right? If you're on Medicare, Medicaid, like you were talking about earlier, you can only use these certain medications. If you have cancer, you can only do chemo and radiation. Like the pharmaceutical companies have captured the government to a
Yes. And
point to
they
where the poorest among us have to use their solutions and pay them
Yep.
through the government.
Right. And it's taxpayers that are paying for it. For anybody that's on assistance, it's taxes that pay for that.
Yep.
So that means the citizens are paying for that, whether they agree with it or not. I never voted to make chemotherapy mandatory for children if the doctor says it, and if not, if the parents choose not to do it, they get the children taken away. And chemotherapy, if I'm not mistaken, only works 5% of the people that it's used on. It's like CPR. I have to take the CPR life-saving classes, right? I'm also OSHA 30, but I'd have to take CPR every 2 years, right? Do you know how many people are saved by CPR that it's used on? Less than 4%. But yet, it is a requirement for me, and a lot of employees on jobs have to take that course, which costs over $200. So these companies are making all this money on something that doesn't even save. It saves less than 4% of the lives that it's used on.
Wow.
That's a money racket to me, honestly. I mean, yeah, sure, you can say 4% of the people get saved. But it's mandated. You literally are required to have these classes, and it just absolutely makes no sense. So I'm required to go do these medical procedures on somebody. I'm not a doctor, but it doesn't even work. That's the problem. It doesn't even work, but 4%, less than 4% of the time.
Yeah, but you're required to do it.
Yes.
Right.
And somebody's required to give you that class, so to speak, but they get paid a lot of money for it. Why isn't that free? Why do you have to pay to take that class if they're requiring you to have that knowledge? Shouldn't have to pay for that. That should be free education, right? If they're gonna require it, nobody should have to pay for it. I guess that's my point.
No, I agree with that. So what about pharmaceutical accountability, right? So there's no liability for vaccine injuries, right?
Well,
here in Washington State,
there kind of is. There are ways, but very few and far between. It's rare. But here's the problem with the pharmaceutical and all that. So if I make this product right here and I sell it and I'm making $1 billion a year, $1 billion a year from this product, right?
Mm-hmm.
And let's say it kills 1 million people and they sue and I pay out, even if I paid out $750 million of my profit, I still make $250 billion, and I still make $250 billion or whatever, right? Still making a profit of billions of dollars. So those lawsuits and the loss doesn't matter because we're still making a couple $100 billion a year. Does that make sense? So they don't even care if they get sued. There's no loss because they still made billions in profit after paying out for all the injuries and death.
Yep.
But
it's not easy to get a settlement from these pharmaceutical companies.
No, but they do get them, and it is in the millions and or billions of dollars, but it doesn't matter because they make so much money that it doesn't matter. They could care less if these people died. They care less if they paid out that money because they still got their condo in the Caribbean and a private island.
They got their money.
They don't care.
Yeah.
There's no accountability for that. If they were tarred and feathered, also there might be some accountability. Bring back tar and feathering. I guarantee a lot of it's going to stop.
Yeah. So another thing that's really, really pissing me off is that, I work with a lot of cancer patients, and their oncologists don't do any dietary coaching whatsoever. Like, you can keep eating a pint of ice cream every night, and they don't care.
I took my ex through cancer, double chemotherapy, radiation, and surgery. And there was no nutritional nothing.
Yep.
No nothing. She come in, they give her a candy bar, for God's sake. What feeds cancer? Sugar.
Yeah.
It's retarded. These people are
And then carbs turn into sugar.
right. I'm diabetic. I eat carbs. My blood sugar spikes all day long.
There you go. Yep.
It's horrible.
Yeah, so that's the only solution that they're offering, right? Is the government pyramid, food pyramid scheme.
I'm here. I'm with the government. I'm here to help.
Yeah, and it does nothing to actually help people.
No, it's actually detrimental.
Yep,
every bit of it. It's absolutely horrible, and there is no true medical freedom in this country. And the more that people want to go to this socialism or whatever you want to call it, universal healthcare means that they have even more control over your health, because you're going to have to do exactly what they tell you to do, and you're not going to have any alternatives.
Yep.
And alternatives do work, but they claim that they don't.
That's a good thing to talk about. I'm glad you brought it up, because universal healthcare doesn't actually mean universal. Universal should mean like every option in the universe, right?
Exactly. Right.
Not only the option we tell you here in this very narrow corridor.
Right. You go to
from what our
acupuncture, they're not going to pay for it.
Yeah.
I have no acupuncture works. I've used it.
That's the thing.
Messed up.
They just want you to be confined to this pharmaceutical road, and you got to be. You can't get off the road. You can't get off the road. You can't go into nature. You need to stay on the concrete or the asphalt.
Well, you know what that you brought up? You said nature, right?
Yeah.
Every single medication out there was made to mimic something from nature.
Yeah.
Synthetically. And what happens when you do that? You're never going to get the true product from nature when it's synthetic. But they claim, but it works. But it doesn't work as good as the natural one. Yeah. Everything comes from nature. Your car, everything in your car came from nature. This computer screen, everything we got here came from nature. Right?
Yeah.
And that's what they don't. Yeah. Everything comes from nature. And we try to synthesize it. And even with the stuff that we're using to synthesize it comes from nature, but they've manipulated it. And it just doesn't work like the original, the natural, the way it comes out of nature. All the drugs, every one of them is something from nature. You ever see Medicine Man?
Medicine Man?
Yeah.
No.
Sean Connery in The Medicine Man. You'll have to watch that. It's a take on that. A really good one.
Yeah. So here in Washington State, we have the West Coast Health Alliance now that is taking over. Right. What would you do as governor to stop that?
I'd abolish that in 10 seconds flat, if I could. It
would take you 10 seconds?
Take me less than that. I'd abolish it, because it's not right for them to do that.
Yeah.
It's not right for anybody to tell other people what to do with their body.
Yep.
And what they're leading into, it's not mandated yet, but it can lead into mandates. Not just mandates, it can lead into laws, because they've written everything in their bylaws, whatever you want to call it, in their legislation for it, that they will have the power. It's like the NDAA. You know what that is, right?
Yeah.
The National
Defense
Authorization
Authorization Act. Yeah.
Act. Have you ever read it?
Not the whole thing, no, but
I've
I'm
read the
familiar
whole
with
thing
it.
many times.
Oh,
It's
wow.
over 1,000 pages usually, right? But in that, if they declare their martial law, they will literally tell you, you're going over to this city over here, this state over here. Everything you have is ours. We're going to distribute it. You know about that?
No.
Oh, you need to read the whole thing. It's if it's enacted, which we're a couple steps away from that right now, from martial law. Oh, you got to read it. You'll be like, what? No way. We're not free. Not only do we not have medical freedom, we don't have any freedom, really. There's nothing we can do without permission or regulation.
Oh, yeah. Oh, for sure. Yeah, I get that. Like, there's very little we can do without permission.
Nothing,
permits
even medically.
Yeah. Well, we can do things if we don't ask for permission.
And we don't let them know about it, but it's
Correct.
illegal to do things without their permission or without their strict rules.
Yep.
Right? So you can't just go over here and even though you know and you have this product you know is going to help this person, natural product, it's illegal for you to go help them.
Or to say you even could. To
Right.
say you even could help them.
Right, because that'd be you go to prison for that.
Making claims.
Yes.
Yep.
They'll call it false claims unless you have their scientific evidence to back it up. Your scientific evidence doesn't matter. Even if you're a scientist.
Yeah.
It doesn't matter what your opinion or what your scientific facts say. Theirs matters.
Yep.
So
I agree.
So it's just like,
all right, Glenn. Hey, we're 40 minutes past the time,
wow.
or 15. Sorry, 10 minutes past the time. But
it's all right. It's good talking anyway.
Yeah, absolutely. So we'll see you again next Sunday. We're going to be here going live 5 p.m. Pacific. Oh, wait, no, you're going to be gone.
I'm going to be on an airplane at 5 o'clock.
Yep. All good. Okay, well, maybe the Sunday afterwards.
Right. That'd probably be a better one. Right on.
Absolutely.
We'll see you then.
All right, sounds good. Talk to you later. You too.